My name's Ronnie Jo Scarlett, and I'm a physical therapist with Schneck Medical Center. I work in home health, and today we're going to be teaching you how to do some transfers. We're going to be doing bed transfers with a draw sheet, and then we're going to be getting our patient in and out of bed to a wheelchair. We start with the draw sheet. After your bed is made, you take any flat standard sheet that you have and fold it in half. Try to remove all the wrinkles you can and lay it on the bed straight across. You'll want it to be laid so that when your patient is laying in bed, the top is going to hit them at the lower shoulder blades and that the bottom will hit them just below their bottom before their knees. Make sure the wrinkles are all out. We'll lay our patient here. We'll be able to grab onto our sheet, lift our patient, and move them. We have Victor here in bed, and we're going to move him up. He's slid to the end of the bed. He's on his draw sheet, and this is what we use a draw sheet for. Put the sides of your bed down first, and we'll have to move him up higher in the bed. Get his pillows ready. Now get in here and get close with your hands right next to his body so you can lift him without straining your back. So we lift and slide up. Once he's in place, you can put the rails back up. Now we're going to get Victor out of bed and get him into a wheelchair. At home, when you get your patient out of the bed, you can put the wheelchair up here at the front or at the bottom, whichever works better. Sometimes there'll be furniture in the room that would be in the way. But we get the wheelchair right up next to the bed. You got to be sure to lock the brakes on both sides. And then wheelchair legs will swing away. There's a clasp on the side that you push and the legs swing away. On both sides, swing away. Okay? Brakes are on, leg rests are out of the way. Then it's time to get your patient out of bed. You gently begin to guide them towards the edge of the bed with their feet. And help them sit up on the side of the bed. Once they're in sitting and they have their balance, you should be using a gait belt. Something similar to this. You wrap it around their body, right at the waistline. You feed your gait belt through the teeth first, and then through the open end. Your gait belt should be tight enough to get 2 hands in, but no more. Before you get them up out of bed, watch the position of their feet. Make sure their feet are properly on the floor, and you should be straddling them, your feet on each side, so that when they get into standing, you can assist them with balance and gently guide their feet if you need to. I was bending with my knees, not my back. Okay, now it's time to put Victor back to bed. We've brought him in to his bedroom and have him right here beside his bed. We got to put our gait belt back on. Just have him lean forward slightly. Wrap the belt around his back and around his waist, or at waist level. Feed the gait belt through the teeth first, and then the open end. Same things as earlier. Get your legs on each side so you can guide his feet when you stand up. Be sure to bend from your knees, not your back. Reach around, grab your patient by the waist at the gait belt, and gently guide them up into standing. Once they're in standing, guide their feet, take steps and just turn them around, and help them sit right back in bed. Want them kind of in the middle of the bed, not too close to the foot, not too high up next to the pillows. And then just gently guide them back down into lying down. And you can take the gait belt back off.